Hi, Be Health Empowered family. Welcome back to another week of Excuse Me, Doctor. I'm your host, Dr. Melissa Clarke, and I am delighted to be here with you today. We are here each and every week on Mondays, 9 p.m. East Coast time, and we are here specifically to bring you facts, figures, and science as it pertains to your health so you can make informed decisions for yourself, your family, and even your community. We don't really deal in misinformation or speculation. We actually specifically debunk misinformation and disinformation every week. So thanks for joining us, especially if you're joining us for the first time. If you're joining us on YouTube, please remember to hit that red subscribe button. And if you're joining us on Facebook, please remember to hit the like button. And this is a show about empowering you to ask questions. Excuse me, doctor? So I really want to make sure that you enter in the chat all your questions as we go along. We're going to get to them towards the second half of the show. And as always, joining me every week are my wonderful co-producers, Miss Lila Mays coming in from LA, and Mr. Wayne Bruce from right here on the East Coast. Welcome, welcome. So yeah, let's hit this recap.
Yeah, let's get into it. Of course, we start with the numbers. So Dr. Mel, where are we with cases?
So we are at 31,903,000 cases of coronavirus that have happened in the United States. And it's just hard to really wrap your head around. But, we were going down, but we're going back up. We're surging, looks like the fourth surge. Cases in Ohio have increased by 25%. We've heard about Michigan all last week, about how they're almost at a crisis situation. So yeah, this is it's not looking good. It's not looking good.
Eek. So what's the death toll?
Unfortunately, we've lost 575,717 souls to COVID-19. And the good news is that the death toll is still going down. So that's good. But I'm not sure how much longer that's going to last, given that we're having these surges that are starting to happen in states around the country.
Right. So what about vaccines, Dr. Mel, and herd immunity?
So yeah, that is the good news. We are at 20% of the United States population that has been fully vaccinated. That's over 60 million people. And there's certain states that, if you have a new or a north in your name, you're probably doing well. So New Hampshire, North Dakota, New Mexico are out there, getting it done. The southern states, on the other hand, are lagging. And so what we're seeing as far as herd immunity is, by July, they're thinking that half the United States will be vaccinated. And together with the people who've had COVID, have immunity from COVID, will be at about 65%, which is far short of that 85% goal for herd immunity. And herd immunity just means that magic number where the virus really is not able to easily jump from one person to another. And so we see that it starts to die off and die down. And so that's where we want to get to. And that's why there's a real request for everyone to get vaccinated if you are eligible. And as of next week, April 19th, everybody 16 and over will be eligible to get vaccinated. So it's not just about your individual health, it's really about the health of the community and the health of the country.
Right.
Wow. Since we're now talking about vaccines and vaccinations, there have been some reports of some reactions, basically skin reactions. You want to talk about that?
Yeah, so we have some data around Pfizer and Moderna vaccines, and we're seeing that they cause two kinds of skin reactions. The first is the kind that happens within 4 hours of getting vaccinated. That is an allergic reaction. And if that happens to you, you should not get the second vaccine because that means you're allergic. However, if you have a skin reaction after 4 hours, likely it is not an allergic reaction. It's just a skin reaction. And it can vary from rash at the injection site, which is seen more often with Moderna, to uncomfortable redness and swelling of the hands and feet, known as COVID toes. They occur in a few patients. Again, these are all very rare, and they go away. And then there's also a sort of an all over body rash that can happen. And again, that goes away as well.
Mhm.
Again, if these happen after 4 hours, probably not an allergic reaction, probably not a reason to avoid getting the second shot. It's always great to check with your doctor first to be 100% sure, but that's really it with the skin reactions.
Okay, if we're going to talk about vaccines, the real problem is COVID-19, and
Yeah.
long haulers and people who even aren't long haulers are have these symptoms that last.
Yeah. So they did a study that showed that 1 in 3 people who've had COVID have either a mental health challenge within 6 months or a nervous system challenge. Now, why is that? COVID seems to like to hang out in the nerves. And so people who are long haulers are seeing these symptoms crop up where if it's a mental health issue, it's generally anxiety or depression, but it could even, be other more serious psychiatric illnesses. And if it's a nervous system issue, it could be something like as serious as a stroke. So, or Bell's palsy, for example.
Wow.
So, yeah, so we're seeing that these things are cropping up more and more. And so I say, and by the way, they did this study in 81 million people. So, this is really good data. And so I say, avoid getting COVID altogether if you can. It's just not worth it because we don't know if you're the person who might have had a mild COVID reaction, but in the next 2 months, you'll be diagnosed with some sort of nervous system or mental health issue.
Right. So I'm going to jump around a little bit. Dr. Mill, we've heard for a long time now that Black folks have had significant vaccination hesitancy, which was kind of true. But are Black people the group least likely to get the vaccine? Is that true?
No, and I mean, you would think that maybe looking at the media with all the media hype around that
Yeah.
that was the case, but it's actually not. Nationwide, only 16% of Black people are a hard no on the vaccine. The real
Mhm.
hard knowers are white Republicans and evangelicals. They seem to be the most resistant, and their numbers have not swung at all since the vaccine has been available. And then there's this like rural urban divide. So only 16% of rural residents say that they're going to get vaccinated compared to 50% of people that live in urban and suburban areas. And again, when you look at Black people in the rural area, 64% of them say, "Yeah, I've either gotten the vaccine or I'm going to get the vaccine." So,
Wow.
the vaccine is going to be available to everyone starting next week. We're still full court press trying to get information out to all communities, including African Americans, including white Republicans, so that everybody will have the correct information to make a decision about getting vaccinated.
Wow, that's
Cool.
good to know. You know, this show is just not COVID. I mean, you being who you are, writing the books you've written, we look at the total person, total human, and we had some legislation this week. Did I say that properly, Lila? So
Yeah,
you
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 gonna
did.
correct
did.
me later?
You did.
We had legislation this week, and it was related to uh, actually doctors and patients. You want to talk some more about that?
Yeah, it is legislation that impacts everybody anytime they interact with the healthcare system. You can now look over your doctor's shoulder and kind of see what they write about you. So before, you would just get a summary that might be available to you at the time you check out, or if you're looking at your medical history online, you just see a summary. Now you can actually see what the doctor wrote.
Okay.
And those organizations that don't make that available are going to be fined according to this new law.
Okay.
So it's essentially, you'll be able to look and make sure that they recorded what you told them correctly. And the hope is that it will make medical records more accurate, help people better understand what's happening with them, and hopefully this all will result in better care over the long run. So it's really about empowering patients, which is, of course, what I'm all about. And move into our show for today. So, we've talked a lot about COVID, and nowhere in this have we really had an entire show dedicated to the heroes, the folks who have been on the front line taking care of patients with COVID-19. Tonight, we're going to talk about them, both out of appreciation, but also to understand the toll that this pandemic has taken on healthcare workers, not just doctors, but dentists and nurses and custodians in the hospital, registration clerks, everybody who works together to make sure that anyone who comes to a hospital is taken care of. And in addition, this show was pretty difficult to prepare for a couple of reasons. The trial of George Floyd is going on right now. Then we had the 20-year-old African American young man, Duante Wright, who was killed in a Minnesota traffic stop. We had Lieutenant Nazario, who was pepper sprayed in Virginia, again during a traffic stop. And then we're having to deal with this as African American healthcare workers at the same time that we're also dealing with taking care of patients with COVID. We know and seeing also too that our coworkers are getting COVID and potentially succumbing to COVID. Healthcare workers are 3 times more likely to contract COVID than the general public. And over 3,600 healthcare workers died in the first year of the pandemic. Half of them were younger than 60. 2 in 3 of them were people of color. 60% of the deaths were among nursing home employees. So, and it's not just the death. Again, it's the mental health toll that's also taken on healthcare workers due to long shifts, more shifts, time away from the family, and oftentimes being the only person there when someone dies because their family can't be let into the hospital. So we have a lot to unpack when it comes to the mental health of healthcare workers, especially African Americans. And so the next over the rest of the show, that's what we're going to talk about. And I have 2 wonderful guests to help me unpack all of this. The first is Dr. Yolanda Lewis-Ragland. She's double board certified, which means she's board certified both as a pediatrician and in obesity medicine. And she is also an author of a book called Navigating a Triple Pandemic: Healthcare Workers of Color Confront Racism in America, Health Disparities in Medicine, and the Trauma of COVID-19. So welcome, Dr. Ragland. Thank you so much for being with us.
Thank you for having me. Thank you so much.
Absolutely. And we have another wonderful guest, Dr. Kimberly Jeffries Leonard, President and CEO of Envision Consulting, LLC, which is a consulting firm that specializes in public health. She's a behavioral health specialist who's held multiple leadership positions in both public health, both at the state and federal level. She's also currently the national president of the Links Incorporated and the Links Foundation Incorporated. So thanks so much for being with us, Dr. Jeffries Leonard.
Thank you so much for having me.
Absolutely. Well, like I said, we have a lot to unpack, so I'm going to get right into it. I'm going to start with Dr. Lewis-Ragland. I love the triple pandemic concept. Can you tell everybody what is the triple pandemic and what caused you to gather 14 other authors together, other healthcare workers, to write about this?
Oh, wow. So what I really, the motivation behind this book was my own mental health that I realized was taking a beating as I looked around and was experiencing the 3 things that we talked about as a pandemic was racism in America. At the time, it was, here we are, ironically, in the at the anniversary, nearly the anniversary of the George Floyd incident, the death, the murder, as you will, on video that we all witnessed. And I wasn't prepared for that. but I don't think most people were. So at the time, you know, in the wake of the George Floyd death, Ahmaud Arbery had just died, and his video had come out, and we had celebrated his life and his death. And all of the tension of racism was spilling out into the street. And then on top of that, we were dealing with how health disparities were being unroofed and really exposed by this COVID pandemic. So the three pandemics, you know, intersected there with this racism, the health disparities in our communities, as well as COVID. And the motivation was my own issues that I was having, that I found I need to figure out how to deal with not only what's happening with me, but the fact that I have to show up each day and help my patients as though nothing else is going on, as though I still have this S on my chest, but knowing that the house is on fire behind me.
Yeah.
And what I did was I reached out to my community, my professional community, and said, you know, am I the only one feeling this? And lo and behold, I was not.
Wow, that's amazing. I know one of your co-authors, who's one of my former coworkers, Dr. Fernando Daniels, emergency medicine physician. He wrote in the book that the first few months of the pandemic, as patients were pouring into the emergency department and were dying despite his best efforts, he said it was like falling into a sinkhole. What do you say to that? I mean, and you know, how do you cope with that as a healthcare worker with that feeling?
Exactly. So what I loved about Dr. Daniels' chapter is that it really showed up, that same theme showed up in everyone's chapter, right? Was this feeling of helplessness. All that we know, all that we've been trained to do, all that we sort of show up to do every day is to help others. You know, that's who we are. That's what we're here for. We show up and we close that gap. And we found out that despite our best efforts, we weren't closing the gap. Despite our best efforts, we were also hurting and traumatized and being continually traumatized over and over again. I feel the same way right now, just watching the trial. I'm being traumatized over and over again. And I talked about in my chapter that PTSD that I felt that I was actually experiencing for the first time. And because we all know what it is, because we diagnosed it, we all realize, well, this is happening to us. And so what do you do in that moment? But what I think what we decided to do is collectively just be very real and vulnerable with each other and find a collective strength in leaning on one another and finding where our resiliency was coming from, and then sharing some of those strategies with one another.
Yeah. Well, I want to bring Dr. Jeffries Leonard into the conversation, being a behavioral health specialist. What are, you know, this isn't over. We're still in the middle of this pandemic, as Dr. Ragland noted, and as I noted in my introduction. You know, the trial of George Floyd is going on now. It's bringing up all the same feelings as when we first witnessed it, and probably even more because we're getting more details. And again, as if that's not enough, these other murders are happening, and by police, and you know, we're surging again in COVID. So what kind of advice could you give to some frontline healthcare workers, even though, you know, many people are vaccinated now, but just in dealing with these multiple issues?
Well, you know, it is, as Dr. Ragland said, it's a pandemic that keeps going on and on and on. We're in the pandemic of health. We're in a pandemic of social justice, and all of these things are things that, you know, we're talking about isolation, and we've seen the effects of that. We've seen, as Dr. Ragland mentioned, the PTSD. We've seen suicide rates go up. For a long time, you didn't see these things in our African American communities or communities of African descent, but we're seeing suicide in our first responders. I mean, we saw suicide in the Capitol Police who were at the insurrection. So we're dealing with so many different things, and what we're having to start doing is really talking about the effects of this pandemic, the health, the isolation, the impact on our mental health, the fact that as first responders, as frontline workers, this, as Dr. Ragland said, this is the job to help people. And very often you've got to be able to help yourself and understand how to do that. And not even being able to say that this is something I need. We've got to be able to start addressing the stigma associated with it. So we've got to make places safe to be able to talk about these issues and talk about the fact that we're all suffering from this, and have safe places to go to be able to talk to someone, to talk to mental health professionals, and not feel that there's going to be any kind of backlash. And we need this across the board. We need this for our frontline workers. We need this for our children. We need this for all of us, because this is a onslaught that I don't think we've ever seen. Many of us have never seen in our lifetime. And it is just, as you said, rewatching George Floyd, the surge, it just goes on and on. And I think that even with the vaccinations, where we start to feel a little bit of relief, there's still the after effects that we are feeling from. It's been a year, and here we still are. So we've got to have people to talk to. We've got to have treatment. We've got to increase the knowledge of suicide hotlines. We've got to make places safe for those who are saving us to be able to get help themselves.
Yeah, absolutely. And when you talk about resilience and strategies, I know, Dr. Ragland, there's one particular strategy that you have found to be very helpful, and you're trying to get other healthcare workers to be involved in. Can you share that with us?
Yes, I'm excited about the fact that, so I was asked to be on the board of directors for the David Lynch Foundation. And our main purpose for the David Lynch Foundation is to spread the information about transcendental meditation, and any meditation, really any strategy that allows you to figure out how to center yourself, how to sort of go into a space where you are dealing with decreasing stress, and any of those things we are obviously for. But particularly in transcendental meditation, studies have shown that it actually decreases blood pressure, decreases stress and anxiety. And once you learn it, once you have it, it's free to use, right? And I find it to be something, we also have a campaign called Heal the Healers now. And so the whole idea is that because healthcare workers, and again, we say everyone, as you stated, Dr. Clarke, this is doctors, this is nurses, this is pharmacists, these are the techs, everyone that has any connection and interaction with dealing with these patients on the front lines are all heroes and are all stressed. And so our goal is to get this practice to as many people as possible who are in this, into serving others through healthcare, so that as Dr. Jeffries said, you want to make sure that we're able to heal ourselves, because our goal is to help heal others. And so it's very vital, that airplane theory. You have to, help yourself first before you can help anyone else. We got to be able to pull the oxygen down and get our deep breath before we can go on and help anybody around us. So.
Absolutely. That is so true. And I mean, that is one thing I think that healthcare workers, we forget, like you said, we show up, we think we have the S on our chest. We don't realize that we have to sometimes replenish ourselves. But then, there's also, Dr. Jeffries, Leonard, you've worked at the state and at the federal level. What can be done? I mean, in terms of any policies or policy changes when it comes to the mental health of healthcare workers?
I'm glad you asked that, because there are some things that we certainly want to do, and not just mental health, substance abuse and substance use disorders, because we're seeing all of that going up. So we're seeing a lot of relapse. We're seeing a lot of onset of substance use disorders because this is such a trying time. So one of the things that we want to be able to do is to really lobby and ask our lawmakers to really focus on funding community-based prevention programs. Those are really effective. They need money. We need to make sure that those are able to be here. We want to make sure that there's enough funding for rehabilitation facilities. We want to look at policies that reduce stigma. One of the things that we've been doing in some of the organizations in which I belong is really talking, and anybody can do this, just talking to our lawmakers to ensure that they are looking at some of the things that this administration is putting out. I'm very pleased that in some of the policies that are coming out, there's funding for training, there's funding for educational programs, there's funding for initiatives that address behavioral wellness and mental health wellness of healthcare workers. That's really critical. We want to make sure that there's policies that address mental wellness in our children, and this administration, and which we've really been pushing, are putting policies out for that. Suicide prevention, certified community behavioral health clinics, all of those things. If you don't have them, then there's nowhere for people to go. Funding to increase provisions to get these kinds of services. If you can't pay for it, then people are not going to utilize it. So you need policies to cover services, you need policies to have facilities in place, and you need policies to break down barriers. And all of these things we've been pushing for, and we're starting to see now. We're starting to see these in the policies and legislations that's coming out of the Biden administration. We're starting to see the Congressional Black Caucus pushing for these kinds of policies. And we ourselves, independently, we need to be pushing for them, because we know we're suffering, but if there's nothing to support our wellness, then it doesn't matter.
You mentioned the wellness of children. And I'm sure you being a pediatrician, Dr. Ragland, and Dr. Jeffries, Leonard being a behavioral health specialist, know about adverse childhood events. And just I know we're talking about healthcare workers, but I think the principle of untreated trauma causing disease, physical disease, not just mental health disease, as we've been talking about, but causing increased rates of heart attacks, causing increased rates of stroke, ulcers, Alzheimer's, Parkinson's, all the chronic diseases that we hear about. A lot of times it has its root in untreated stress. And so that's one of the reasons I think that it's very important, not just to guard our mental health, in the present, but also for our wellness and our well-being down the line. And then, when we talk about, the role of the federal government, we have a new administration. There's a new sheriff in town, thank God. But with the previous administration, Dr. Ragland, do you think that there was a feeling at all that, we were being failed as healthcare workers, or we were just being left out there to dry?
Okay, absolutely. First of all, let's just start with the fact that you do an awesome job at debunking information that we were being told on the media, or people were being told on the media, that we were getting paid money for, COVID cases. Really? The undermining of the administration. The fact now that you had family members walking in, not trusting us and not trusting that we were diagnosing them correctly for the right reasons, because they thought we had some skin in the game or we were getting paid. It was just so egregious and so outrageous. And so we were starting off with that, right? With just having to demystify and debunk that myth that we were getting paid for these diagnoses. Yeah. That's one thing. On top of that, PPP, right? All of the, PPE, getting the equipment that we needed to just protect ourselves. The Veterans Hospital didn't have enough equipment for their healthcare workers and their people who were trying to help their communities in terms of serving. So we were being, overlooked. We were being put out to under the bus, right? About the fact that we were supposedly getting paid. then we weren't being protected because we weren't getting the equipment we needed. I mean, thank God we didn't necessarily find ourselves reusing equipment, but it was like, use it as long as you can.
Yeah.
Right.
A
A lot of
people
places
did.
did, right?
Yeah.
And so healthcare workers were definitely feeling that. And then so I think there's multiple ways. And then again, this whole thing with our health, it was as though you still had to show up. It didn't matter if you had chronic illnesses or any diseases, or if you lived at home with anyone who you thought you might be, putting into any jeopardy. So you had healthcare workers who decided not to go home, to stay in hotels, to stay on one level of their household and not go on to the other levels because you didn't want to. I know personally, I didn't want to expose my children in the beginning. So I stayed on the bottom level where there's a shower. I could come right in. I could undress. I could make sure. But it was a lot of fear, and we weren't getting any support federally from the previous administration as to how we could maybe be funded in some way to help us protect ourselves. And so, absolutely, the answer to your question is we were definitely being failed. We were definitely
I'm going somewhere with this because in the preparation for the show, I was actually surprised to find out that 60% of the deaths happened in nursing home workers among the 3,600 plus deaths of healthcare providers. And interestingly enough, they're actually the one of the groups of healthcare workers that's the most resistant to taking vaccines. And I'm wondering if that's because they feel that they were failed by this government, the same government that's supposedly developing this vaccine. So, why should I take it?
I mean, that's a good question. Definitely a good question.
That's really an interesting concept because, when you look at the nursing home healthcare workers, my grandmother was in a nursing home. She passed from COVID and got it in the nursing home. But when you look at that, it brings all of these things that we're talking about to bear. If the only way I can feed my family is to go to work, and they're telling me that if I have a symptom that I can't go to work, then what am I going to do? And so there's so many things that are a part of this whole idea of what this government has done. I mean, even the way, depending upon what state you were in, you were getting mixed messages in nursing facilities and those who were working in nursing facilities. So there's so many things wrapped up in that healthcare worker in the nursing facility idea of that issue. That it really is hard to unpack. And you're right. You're seeing most of the deaths there. We were seeing most of the patients, and then they weren't even testing our healthcare workers within the facilities for often for a very long time. So,
well,
a lot going on there.
I am really sorry to hear about your grandmother. I know a lot of people have lost a loved one to COVID. Especially being African American, that, it's been disproportionate in our community. And, to your point, Dr. Ragland, part of this triple pandemic has been the healthcare disparities and how it is disproportionately, even among healthcare workers, 2 in 3 healthcare workers who've died have been healthcare workers of color. So, just all the way around, you're right. It has just been a very unfair, confusing at best time. And I with vaccinations and a new administration, I at least have a little measure of hope that we're shifting the conversation from health disparities to health equity now, and we're trying to look for solutions. So I think it's about that time to bring in our co-producers, Wayne and Lila, because I'm pretty sure they have some questions from the audience for us.
How sure are you?
I'm pretty sure.
So actually, we have a few questions. We have a question from Artilia Moore, and she writes, "Hi, I had my second Moderna vaccine shot on Saturday. About 12 hours later, I got bone chilling chills. then body aches, hot sweats, tired, and no energy all day the next day. Today she feels much better. Why did some people get side effects while others don't?
I can go ahead and take that. What what is happening with those side effects basically is that is your body's immune system revving up to be able to fight the coronavirus. Now that it's been exposed to a little piece of the coronavirus, your body is now making antibodies. And when your body makes antibodies, one of the things you can experience, or some of the symptoms you can experience, are a sore arm. You can also experience fevers and chills and headache and fatigue, maybe even a little bit of nausea and body aches. But typically, just as you said, it happens in 24 hours and goes away. The older you are, meaning if you're over 55, you're less likely to get those side effects. You might just get a little bit of fatigue. If you're under 55, you tend to get those side effects more. And that's because when you're under 55, your immune system is a little bit more aggressive, a little more rambunctious. And so, it's going to give you a more robust response than somebody over 55. It's not hard and fast. Certainly some people over 55 get that too. But in general, that's around where the cutoff is.
All right. Lila.
I have a question from Angela Mays, and she says, how do we as patients and or friends and family make it easier for the healthcare provider?
I'll let each of you take that. You want to go ahead first, Dr. Ragland?
Yeah. So first of all, Angela, I think that first your question itself is very helpful because it shows some empathy. I think that one of the things that is very important for us is for our patients to recognize that we are human and that we have families. We have just as much sometimes trepidation, not so much fear, but we are also a little bit, cautious. And so having real conversations and being very candid with us and really just asking, how are you doing? Oftentimes that's enough for us to recognize that you see us as people. And then what I really want to say is listen to your trusted healthcare workers. Ask us your questions. I spent all day today debunking TikTok. I'm a pediatrician, and I had 18 and 19-year-olds, and I had 20-minute conversations about what they were learning on TikTok and Instagram. And I thought, okay, but at least they were being very open and honest about telling me what their concerns were and giving me that information. We had a real conversation. So just, sharing with your healthcare professionals and trusting us because we really do have your best interest at heart.
Okay. We have a question.
Dr. Jeffries, Dr. Jeffries, do you have anything to add there?
I'm just going to reiterate what Dr. Ragland said. As a consumer, my doctors tell me, please just be compliant. Be compliant and you'll make my job a lot easier if you could just follow what I say, follow my directions, because then you don't have to, as she said, you have our best interests at heart. And then I don't have to put you in any kind of additional jeopardy by getting sick or doing something where you've got to come and go out of your way to do something else for me. So being compliant and asking questions and following their directives and their guidance, I think that's really one of the things that we can do to make their jobs easier.
Great, thanks.
All right, thank you. Can I speak there, Lila? I'm sorry.
Yes,
I'm sorry.
unless Dr. Mel has an answer for
Do
that
you have
question.
Answer?
Oh, no.
Okay.
I think they covered it. They covered it.
All right. So we have one coming from Yvonne Smith. And Yvonne writes, are breastfeeding mothers who have been vaccinated passing the antibodies on to the babies? Yes, no, we think so.
Well, I actually would normally take that, but I have a pediatrician on tonight. So I'm gonna turf it right on over there. Dr. Ragland.
So right now, the studies are actually really early. We're actually not exactly sure how much is getting in. Anything that's in your AGA would go over into your secretions of your breast milk. Most of the antibodies that you make from a vaccine, however, happens to be IgG. So there's not necessarily a full like one-to-one, like you're actually passing the full immunity, but you are given some immune properties to your child. For any virus or any bacteria that you sort of see yourself, your body's going to make immunoglobulins and you're going to be passing some immunity. But right now, I can't say that we have a lot of data, but you're always going to be passing something. But the most that you pass in your actual secretions is a bit of a different immunoglobulin than we actually produce when we get a vaccine, if that helps. What's great is there's no contraindication. So we don't want you to not get vaccinated because you're breastfeeding. That's actually, for me, the most important response to that is that we have no reason to believe you shouldn't get vaccinated if you are breastfeeding.
Right. And just to break down immunoglobulins a little bit, it's just the antibodies. It's a fancy term. There are different kinds of antibodies. And so they're different IgA, IgG. But and I think Pfizer has been coming out and saying that they've actually seen antibodies in the cord blood, meaning, when the baby is first born, that antibodies are passed that way, and that they are seeing some in breast milk, but we need more research to know 100%.
All right.
All right, great. I have a question from Jessica Owens, and this is for every doctor, each doctor. What are your go-to stress relievers?
Ooh, good one. I'll go last. Dr. Jeffries, Leonard, you want to go first?
Walking the dog. That is my go-to stress reliever. It allows me to get a little bit of exercise. I get to step away from everything that's going on in the house that, sometimes gets to be a little bit crowded. Sometimes I can, as Dr. Ragland said, do some meditation. It'll make me look at, I can look at nature, but it is absolutely the stress reliever for me.
Dr. Ragland?
Yes. So yeah, definitely for me, I think the biggest one is meditation, just because I can do it anywhere. If I'm at work, if I'm traveling, I'm on the train, I can actually meditate pretty much anywhere I am. I've gotten really good at shutting my kids out and anybody else around me. So it's actually been pretty good. But then I'll also go with the first answer as well. I'm exercising. I walk anywhere. If anybody knows on my social, I'm always walking. I walk when I get to New York to Central Park, around it and back. So I'm a big walker without the dog. I'm just walking. So yeah, it's great.
And walking for me, definitely at one of my favorite spots, which is a regional park that has beautiful flowers and lots of trees. I like to go onto the trails, surround myself in nature. And then a lot of y'all might know that I had a health challenge earlier this year. I had surgery, abdominal surgery. And so coming back from that, I have a good friend who actually taught me Tai Chi. And so, and also to take Epsom salt baths with lavender. So both of those things I would have to throw in as well are also great stress relievers for me.
And I ride my bike. That's my stress reliever.
Wow.
That's key.
Wow. I cook now.
He does.
Got to keep this figure in shape somehow.
he cooked every day for me while I was recovering. So
wow.
Hey. I'm at work. This is professional now. Get into that. And I play my guitar. I'm a musician by trade, and a producer, so I play music. That's stress relief.
Absolutely.
So we have a question from Karen Walker. Because of the past administration has politicized and devalued science and public health guidance, how do we encourage those in our community who are vaccine hesitant to take the vaccine?
Well, I think all of us can answer this, so I'll probably go in order. But one of the biggest ways for, I think, us to do this is to show our own willingness to be vaccinated and be very transparent about it. I think most of us have either shown on our social media that we got the vaccine, that our families got the vaccine. As a person, as a pediatrician, all 3 of my children have been vaccinated, and I've been very vocal about that, down to my 16-year-old who, as Dr. Clarke knows, was with us last weekend. And when I found out that fair, and it was Johnson & Johnson, so I trusted it, you know. For anybody who says, well, you all get the best vaccines, I have my own mini study. My oldest got Moderna, my son got Pfizer, my daughter got J&J. So I have a little study going on over here, and everybody did great. Everybody did fine. But I think part of hesitancy is how we combat it is just being transparent, being very open about what we're willing to do, what we're noticing, and what our own trepidations were, if we had any, and how we sort of overcame them. And because really the messenger is as important as the message when it comes to our community. So, you know, they want to hear it from us. And so we're out here and we're doing things like this, spending our time and really giving the effort to let people know we care about what's happening in our community, and we care about them. We care about you.
Wow.
And Dr. Jeffries, Leonard, any psychological tips?
Well, I agree with Dr. Ragland. I think it is the messenger, and sometimes, and I agree with being transparent. Sometimes it's not always us as the messenger. Sometimes it's the influencer that our community looks up to. I know there are tons. We have tons of relatives. All of us have that. You know, I'm not listening to what you said. Of course, that's what you're going to say. But somebody else may take it. Somebody that they look up to. And then that is really the trigger for them. I thought it was really interesting. Saturday Night Live had a little skit where they talked, you know, what can I give you to take this vaccine? $5,000 to that. I'm not taking it. But it's just that one person. That's why all of us need to be transparent about taking it, because we don't know who that person is who's going to influence our communities to take it. And so as many people that we can get to get that message out there, one of those messengers is going to resonate with somebody. And that's going to be the key. The aha will let me go ahead and take it. I know for some of my friends, I can speak until I'm blue in the face, but just, you know, they see somebody on Instagram, you know, so-and-so took it. And do you know what they said? Didn't that what I just been telling you for the last 6? And then that's the thing that's going to move them forward to make sure that they go and get the vaccine. So as many people out there as we can put out there showing that they're taking this, then I think that's great. And what I say, and I love the fact that you have your mini study. My position is when people say which one, I'm like, whatever needle they got coming at you, put your arm out there and take it, because whatever they've got going on is better than the alternative.
Right.
Absolutely.
And then, not much more to say after that, but I've been out here in these Zoom streets for a minute now. And I do at least 3 Zooms a week outside of the show, and I'm using Zoom in a general sense, but community forums. And I've actually started doing some in person now with that event that Dr. Ragland mentioned. And, the one thing that I would say is, to honor what people's fears are, to listen to what their fears are. Don't belittle them. And then meet it with fact, because the fact of the matter is the Black community has been targeted with social media disinformation for over 5 years now when it comes to vaccines, and they've just repurposed it and tweaked it to talk about the COVID vaccine. And the fact is, a lot of us don't have the relationship with a doctor or a nurse or somebody who has the facts. And so therefore we default to social media in the absence of information. And so that's why I've tried to make myself as available as possible to talk to people, to give them the facts. And people they just want their questions answered for the most part. And We as healthcare professionals are doing that, and there are a bunch of people who've been deputized. Wayne
Right.
Bruce being one of them. Lila, I know she's doing it. Pastors in the community, teachers,
Right.
and like Dr. Jeffries Leonard said, just somebody who you know and respect who decides to take it. That in and of itself can be influential.
Right. So we get one last question, and it seems simple enough, but it's been some varying, and I'll let the doctors handle it. How long, it comes from Nicole Gibson, how long does the vaccine last after getting it?
So I believe that's Nurse Nicole Gibson. Hi, Nurse Gibson. So what we do know is that 6 months is the minimum. Pfizer just came out, and Pfizer is the first vaccine to sort of hit the street, so to speak. So they have the longest data. And I think Moderna just came out with the same thing because they were right behind
Yeah.
them and confirmed that 6 months is the minimum amount of time for immunity post vaccination. They are going to be following people 2 years out. So we're going to get periodic updates as to, how long the immunity is continuing to last. But we do know at least 6 months is the answer.
All righty.
That's it. All right. Well,
It.
thank you. I first of all, I want to thank my panel. You all were fantastic. Thank you for sharing your stories with us. Thank you for sharing what we need to know in terms of mental health care, self-care, resilience, how we're going to continue to move through this and get through this, all the things coming down the pike in terms of mental health care reform that will benefit not just healthcare workers, but Americans in general. Thank you to my co-host. Y'all throw down every week with the questions and helping me with the recap. So thank you to you both. As you know, I will be on the Russ Parr Morning Show tomorrow morning if you want to catch me there at 8:50 a.m. And we will be right back here next week, Monday, 9 p.m. Eastern, 6 p.m. Pacific, right here on YouTube and Facebook. Want to thank you, the audience, for your wonderful questions. I'll try to get to the ones in the chat that we might not have gotten to. And until I see you, please remember, be wise, be well, and be health empowered. Thank you all for tuning in tonight.
Thank you.